Dear students, welcome to this lecture. Today we are going to look at patterns of DUB and their management. DUB refers to dysfunctional uterine bleeding, as we had previously echoed, and we are going to look at patterns like menorrhagia and the rest. So to begin with, we shall look at menorrhagia. I am by name Skiden Robina, and I will be taking you through this lecture. This is part of our gynecological topics that we have been looking at. So menorrhagia refers to excessive blood loss during a normal cycle, common in women over 30 or with multiple children. Then we have another pattern which is known as epimenorrhea, and the epimenorrhea refers to frequent menstruation. Then we have metrorrhagia, which refers to irregular non-cyclic bleeding. So what are the clinical features of DUB? The clinical features of DUB includes the following: complaints of irregular or heavy bleeding. Someone can complain about one or both of them at a time. This diagnosis of DUB include transvaginal ultrasound, hysteroscopy, dilatation and curettage for biopsy, where a tissue is got from the uterus, then it is analyzed or it is studied. Then we have blood tests for HB levels and the hematocrit. Nursing diagnosis for DUB: altered sexual patterns due to abnormal bleeding. So the woman cannot enjoy sexual activities with her partner because of the kind of bleeding that is happening. Then anxiety over the possibility of cancer. Cancer being one of the diseases or conditions mentioned for to manifest with bleeding. Once the person has bleeding of unknown origin, she starts anticipating cancer. Fatigue due to anemia caused by excessive bleeding. So management of DUB: referral. Patients at the health centers should be referred for investigations and treatment in well-equipped facilities. Stabilization: if severe bleeding occurs, stabilize with IV fluids before referring the patient. Investigations: comprehensive history and physical exams, including systemic, can be done to the mother. Treatment for DUB: correct anemia if present. In most cases, the mother will suffer from anemia because of the irregular or excessive bleeding that happens. So this, if detected, needs to be corrected immediately. Teenagers, in teenagers, estrogen progesterone combination therapy can be administered for 3 to 6 cycles, and sometimes it works and it really corrects the problem. Reproductive age women, rule out pregnancy complications or malignancy. Women over 40, you need to investigate for organic causes such as cancer, and also consider hysterectomy if needed. Ovulation stimulators, e.g., clomiphene citrate for cycle regulation, can also be done. So let us look at menorrhagia. Normal menstrual cycle with heavy bleeding which exceeds 70 mils per cycle is what is known as menorrhagia. So the common causes include fibroids, chronic PID, endometrial polyps, blood clotting abnormalities such as leukemia, thrombocytopenia, hormonal imbalances leading to thick endometrium, emotional stress, and the IUD use. So these are some of the common causes of menorrhagia. So let's look at the management of menorrhagia. Primary care. The primary care that has to be given to a woman who is overbleeding or having a condition known as menorrhagia should be to refer to a well-equipped hospital for detailed investigations. Investigations that can be done include the following: pelvic exam, blood tests for clotting and HB levels, D&C under general anesthesia, because it can really be painful, so the woman has to be put under general anesthesia. So this may be curative if no other abnormality exists. In case no other abnormalities exist, if the endometrium is scraped off, you are using D&C, sometimes it can cure the condition. Treatment options: pre and post-operative care for D&C should be done. D&C, as we all know, stands for dilatation and curettage. Hysterectomy can also be done in older women. The other pattern of DUB is metrorrhagia. Metrorrhagia stands for prolonged menstrual bleeding due to irregular endometrial shedding, often caused by slow degeneration of the corpus luteum. So in this case, the bleeding will be prolonged. It will take more days than expected, and this is caused by the fact that when the ovum is released, the remains of the ovum that turns into corpus luteum takes long to degenerate, because in the normal cycle there are expected number of days that this corpus luteum takes to degenerate. Then after that the cycle repeats itself. So when it takes long, then it means it prolongs the days. So common causes can be cancer of the genital tract, uterine polyps, incomplete evacuation of post-abortion, then hydatidform mole, then chorion carcinoma. These are the common causes of metrorrhagia. How do we manage metrorrhagia? The first step is history and physical exam. Comprehensive history and pelvic exam with a pap smear, referral with a pap smear. Then the second step is a referral. Send a patient to a gynecologist for further assessment. So what we need to do after all this is, as a reminder, we should never dismiss metrorrhagia lightly. Ensure thorough examination, because it can be something more than what we suspect or anticipate. The other pattern of DUB is epimenorrhea. So epimenorrhea refers to normal menstruation occurring too frequently due to a shortened luteal phase, leading to early degeneration of the corpus luteum. So this, instead of the corpus luteum degeneration being prolonged, here it is being shortened. So it occurs, it takes fewer days to degenerate. So when this happens, then it means that the cycle repeats itself so frequently, and leading to frequent menstruation of the woman. So management of epimenorrhea. One is detailed history to determine the cause. Ask the woman, interrogate to find out exactly what is happening with her so that we can be able to rule out the cause. Then referral, sent to a hospital for further investigations. Treatment for young girls, combination of estrogen and progesterone can be given to them for 3 to 6 cycles. Iron supplements to replenish blood loss. So, in case the woman has lost lots of blood because the bleeding is coming so frequently, then she can be given iron to boost her red blood cells production. For reproductive age women, consider diagnostic dilatation and curettage and rule out malignant causes like causes that are cancerous. If dilatation and curettage fails, hysterectomy may be recommended, preserving ovaries if possible. So if the DNC has failed, then the uterus may need to be removed, but preserving the ovaries can remain in place so that in case the mother needs to reproduce using other ways, then her ovum can still be picked and she can reproduce. Then the other pattern is hypomenorrhea. Hypomenorrhea refers to regular menstrual cycles but with minimal blood flow. Scanty periods, this is what we can term them. They are regular, they come regularly, but the flow is scanty. The flow is the amount of blood that comes out is very, very minimal. So this occurs in cases like very long menstrual cycles, and an example is 2 to 3 times per year. So key things that we need to note: metrorrhagia, epimenorrhea, and hypomenorrhea have distinct causes with underlying pathology requiring thorough evaluation. Endometriosis and adenomyosis involve the abnormal presence of endometrial tissue, leading to pain, infertility, and sometimes complex surgical needs. Early diagnosis and treatment can alleviate symptoms and improve outcomes for patients. So that is all for today's lecture. Thank you so much for being part of it.